The Wellness Revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to Dr. Hotze's Wellness Revolution. Today I want to introduce you to one of our very esteemed colleagues who works here at the Health and Wellness Center, Angelica Clark.
Hi.
Angelica, welcome to the show.
Thank you.
I want you to meet Angelica because she's one of our providers here. She's been on staff here at the Hotze Health and Wellness Center since 2014.
Yes.
Angelica originally comes from Brazil. And since she was a little girl, she wanted to move to the United States.
Mm-hmm.
Why did you want to move to the United States?
Well, I wanted initially to be a missionary here in America.
Well, we really need to have other countries the way we're going send us missionaries. That's for sure, isn't it?
That's right. So God brought me here, and my grandfather was a Baptist pastor, so we always had missions and missionaries coming to Brazil, and that was a desire of mine to come here to America for that reason.
So you came here in 2003.
Yes.
And you had already received a Bachelor of Science degree in nutrition at
Yes.
the university in Brazil, right?
That's right.
So you came here, and what did you do when you came here initially?
I had just graduated in Brazil, and I have this company that invited me to come to America. They were going to sponsor my green card, and I was going to work as a nutritionist in New York. But I met my husband, and we got married, so things changed.
And where did you move?
Then we moved to Virginia. He was tired of the snow, and in Virginia, I got into learning about being a PA and helping people make life changes because nobody wanted to listen to me as just a nutritionist. So that's how I got started.
Well, you told me a story about a little boy that had been sick, and you were a nutritionist, and you counseled the mom to do something. Share that story with us.
Yes. I had a friend who worked with me. I was working at Anthem Blue Cross and Blue Shield doing their medical review, and her boy was always sick. So one day I told her, I said, you should call his doctor and get him in good nutrition program or do something to support his immune system. He should not be this sick. And I was also worried about him on antibiotic all the time. Right. His poor little gut, he was just a little tiny boy. So I saw her pick up the phone and call his doctor. And a few hours later, she got a call back. And I was so curious to hear what they had to say. And then she said, well, the nurse said that there is nothing you can do to support the immune system. And it was just so sad.
This is a constant point we hear from our guests here at the Hotze Health and Wellness Center. They say they talk to their doctor about their problems, and the doctor it goes over their heads. If they have chronic illnesses and infections, that's a sign that they have poor immune system, and you want to build up your immune system. Right. And this doctor told the mom, there's nothing you can do to build up your immune system. Well, that's haberdash. That's just ridiculous. Of course there's things you can do to build up your immune system.
I know.
Vitamin and mineral support, good nutrition, good healthy eating program, exercise, plenty of sunshine. All these things are very important to building your immune system. God gave us an immune system to help us fight off infections. And if you're chronically sick with infections, that's a sign that your immune system is unhealthy. And it can be unhealthy for a number of different reasons. Hormones are one of those problems. But anyway, so what happened then?
Then that day was a sad day for me. I actually went home crying. And I was telling the Lord, Lord, I want to help people. And this is what the kind of answer she gets. And people don't listen to just a nutritionist. I learned that in this country, there is a lot of validity to what the doctor said, but, not as much about other people. So I went home, and my husband told me about, he said, my aunt is a PA. Why don't you look into going to PA school? Then you can be a doctor. You can be somebody's provider and, and help them with nutrition and, wellness the way you want to do. And I started looking into it, and I got into PA school
Now, where did you get your PA degree?
in Virginia
What school?
at Jefferson College of Health Science. It's a school that is affiliated to the University of Virginia, the UVA.
That's great.
Corellium.
And so, in some way, once you received your degree, you worked your way down here to Texas, didn't you? Did you come immediately?
Yes. So my husband, always my husband, he was
Tired of the snow in Virginia,
he was
too.
tired of that too. He was born in Dallas, and then he moved to New York when he was 9 years old. And at the time, his grandparents were getting older, and he wanted to spend some time with them since he had not done so. And it was a blessing, since then they have all passed away, and the Lord brought us here in a good timing. And I love the weather. Texas is home, y'all. It has become my home. I love the weather. I love the people. I love the kindness, and it's lovely. I love Texas.
Well, so you came here and went to work as a PA. Where did you start?
I started at a weight loss clinic in a tiny little town called Hamilton, Texas, nearby Stephenville, Waco area.
Right.
Very country.
Right. And then, in some way, you heard that we were looking for physician's assistants.
Yes. I was a cyclist, and I used to ride bikes, road bikes with my husband all over the state of Texas. And there was this bike ride every July here in Katy that we used to come. And I started looking because we were coming to here, and I saw, let me look functional medicine or PA or wellness in Katy, and I found your practice. And I started reading. I was like, oh my goodness, it's all, I can serve the Lord and serve the people. So I was really excited, and came to find out I call him my brother. He's my childhood friend. His name is Italo. He's married to Tressa, and to Tressa's sister.
Right.
And so he was like, you talking? I was like, I'm gonna apply for this job at the Hotze. I didn't know how to say Hotze. And he's like, you mean Hotze? Oh, my sister-in-law works there. And then we was just all like ordained. The Lord really opened the doors, and here we are 7 years later.
Well, as you can see, Angelica has a very pleasing personality. She's very attractive and enjoyable to be with.
Thank you.
And she does a wonderful job with our guests. Now, here at the Hotze Health and Wellness Center, as you may be well aware, we practice natural approaches to health. In the field, it's sometimes called holistic medicine or integrative medicine or functional medicine, but it really is approaching health problems naturally, trying to find underlying causes to health problems and addressing those underlying causes rather than trying to suppress the symptoms with pharmaceutical drugs, which I presume you were trained to do that.
Oh, absolutely. Yes. In my bachelor's degree in Brazil in nutrition, when I had it to be matched with American degree, they told me, you have 93 extra credits. So we really had a lot of nutrition. We actually had like 1 year and a half of food biochemistry, where you learn in depth about the Krebs cycle and all the things that you'd want to know.
No, really, that's amazing. In medical school, guess how many hours we had of nutrition?
I bet very little, maybe a semester.
0.
Oh, really?
Guess how much we were taught about vitamins and minerals?
Probably 0 then.
0. Why? Because the pharmaceutical companies basically control the medical schools, and many of the physicians get grants from the pharmaceutical companies in order to run their studies. And so it's a pharmaceutical-based industry in the United States. It's very conventional, and the doctors are trained that way by their elders, the statesman doctors who've been around for a long time, and they can't imagine. Most doctors can never really break out of the box and approach health issues more naturally so we don't poison our people with drugs. I might mention to you, You've heard me tell this story before. When I graduated from medical school here in Houston, my dad took me out to dinner. Had a banquet for me, and he turned to me over dinner and said, "Son, don't poison your patients like all the other doctors do. Do you understand me?" And it was not a request. It wasn't a recommendation. It was a command, and that planted the seed in my mind that gave birth to the Hotze Health and Wellness Center, because I realized, and I learned it in my first semester of medical school, that all drugs are toxins and they have to be detoxified. Toxin, by the way, means poison. If you look up the definition of toxin, it's poison, and it has to be detoxified by the liver. And the more drugs you get on, the sicker you get. In fact, you get sicker quicker because it poisons the energy plants in your cells, the power plants called the mitochondria, and it poisons those. So people get on drugs, and instead of getting better, they get worse. They feel terrible. And what does the doctor do? We got another drug. You got a side effect of that drug, we'll give you another drug. So this is what we see commonly in our guests that come to the Hotze Health and Wellness Center. So describe to us, I know this, you went on recently in the last year and received a certification from the Institute of Functional Medicine.
Yes.
Functional medicine is another term for natural approaches to health. Some people call it, as I mentioned earlier, integrative medicine or holistic medicine. But it's simply approaching things naturally, trying to discover underlying causes and treat them with natural remedies that will help people resolve their underlying causes so they can regain their health. Remember, folks, God gave your body amazing restorative power. If you put the right molecules in your body, you're going to be healthy. Put the wrong molecules in your body, you put poisons in your body, you're going to be sick. Nobody can poison themselves to good health. It's impossible. So tell us what you learned when you went to the Institute of Functional Medicine and were certified there. What are some of the things you learned that you could integrate that you've integrated into our work?
Like you said.
Or was it more just of what we've already done?
Exactly. Like you said, what we do here is natural approaches to health, and we had been doing that all along. It basically gave me more tools in my toolbox. Functional medicine, is more looking at as a systems-based approach to medicine, which integrates also the allopathic medicine to get you going, and then you introduce the natural approaches, which is what Dr. Hotze has been doing this for years. So it's a certificate, it's a recognition, but it's really just another tool in my toolbox. We are very proficient here in keeping up with the newest data and making sure we're learning everything that will help you, feel well. And so we have the best approach here already. So,
in the purpose that we have here at the Hotze Health and Wellness Center is to help each one of our guests, and we call our patients guests. The way you describe people is the way you think about people, and everyone listening, I'm sure at one time or another, has gone to a doctor's office and sat in the waiting room, knocked on the window, been told to show your insurance card to sign in and sit down. And you know you're going to wait and wait and wait. Yeah. There's nobody out there to talk to. You got a bunch of sick patients, and you're treated like a number, basically. It's like a cattle trough. You just run them in and out. And the doctor, because many people and most people are on HMOs and PPOs, the doctor only they don't get paid per visit. They get paid a certain amount a month. It might be $5 a month for every patient they have, depending upon the age, or $10 a month. So they have got to see, they've got to have a lot of patients that they run through the office if they only get reimbursed, and that's a month. So they don't have an incentive really to want to be able to see you, because they're going to get paid that whether you come in or not. They get paid $10 a month. So can you imagine that a doctor is going to provide you good health care for maybe $100 a year? That's what they're going to take care of your health, and you may be sick and have a host of health problems. That's the reason that you oftentimes call a doctor's office and say, well, it'll be about 3 or 4 weeks or a month or 2 months before we can get you in. And the reason is because that doctor, even though he takes HMOs and PPOs insurance, He also has cash-based practice. If you're a cash-based patient, you'll get in that day or the next day very quickly because he knows he can charge you a fee of $125 or $150 or $200 on a cash-based basis. But he can't earn that amount of money by seeing all his HMO and PPO patients. So that's why when doctors work for insurance companies, they have to work around to ensure that they generate enough income to keep their businesses going. And the insurance companies also, as you're well aware, having worked for Anthem and Blue Cross Blue Shield, require doctors, anytime they want to do any kind of procedure or blood tests or medication, the insurance company tells them what they can and cannot do. And I determined years ago here at our practice that we were never going to do HMOs, we were never going to do PPOs. As a matter of fact, we were going to offer cash-based practice. It's kind of like when you go to a restaurant. You don't tell the people of the restaurant, well, just charge it to my insurance, okay? Yeah. It doesn't work that way. You pay at the time services are rendered. What a very novel concept. It's called fee for service, and it's the same thing you do with all other businesses around town. You pay for the services when they're rendered, and that's the way we operated here. And so that's why many patients initially they want to go to their insurance doctor thinking he'll solve their problems. So tell us about patients. Describe one or two of the patients you've had that have come in that have seen multitude of conventional doctors, the kind of symptoms they come in with, and how you approach that.
The most common ones that have been to so many doctors are the women, and especially after having had children and childbirth, and they are feeling like they're about to lose their minds, and they've been convinced by their doctors that they have lost their minds, and they are depressed, and they need to see a psychiatrist. And they come and they say, I wasn't this before, and I am like this now, and something is wrong. And many of them just break down crying just because you're there listening, like listening. Be prepared. When you come to see me, you're going to be doing a lot of talking because, the history makes a big difference. And we start talking and we find out, their hormones are out of balance. Their thyroid quit working. And once we start putting the body back in balance, then they're hormonally, nutritionally balanced, guess what? They were not out of their mind. They had their mind all along. They just needed balance.
Well, that's commonly what we've seen here. We've seen over 33,000 guests here at the Hotze Health and Wellness Center since we established it here out in the west side of Harris County in the Katy area. We have seen 75% of our guests are women, so we have seen this. I've written a book called Hormones, Health, and Happiness. By the way, if you'd like a copy of that book, I would be pleased to send it to you free of charge, free shipping, if you'd simply call our new guest consulting department at 281-698-8698. And you see the number on the screen there. Just write that down, 281-698-8698. Give a call and say, I'd sure like to get a copy of that book that Dr. Hotze wrote, Hormones, Health, and Happiness. And let me tell you what, I wrote it specifically for you. Yes, I wrote it for you. And because I spent time listening, women would come in and tell me they just like Angelica described, they'd tell me the doctor made them feel like they were crazy.
Yeah.
And women often tell me, they make me feel like I'm a hypochondriac. And if you have problems with low energy levels, if you're having difficulty with weight, if you can't think clearly, if you're cold, have cold body temperature, if you've got joint muscle aches and pains, if you've got sluggish bowel function, if you've got chronic skin disorders, if you've got hair loss, if you've got puffiness in your face, if you've got ridged fingernails, if you're sick frequently on antibiotics, these may be due to underlying hormonal declines and imbalances. Also, allergies can cause problems, and we treat for airborne and food allergies here at the Hotze Health and Wellness Center using a very innovative method called low-dose immunotherapy, and you can take 3 drops under your tongue once every 7 weeks. We've had remarkable success with this method of treatment allergies. And, of course, people, when they get antibiotics to get yeast problems. You women know that. Women used to tell me, if you're going to give me an antibiotic, in the old days it was prescription. Give me some Monostat, please. And we'd have to treat them with that. We also supplement with natural thyroid hormone, natural female and male hormones too, for men. And we treat for adrenal fatigue. And then we have a good balanced eating program, which is keto-friendly. And we encourage a decline or decrease in the amount of carbohydrates you take, and an exercise program. So tell me, when you've had women come in, and by the way, when they're made to feel like a hypochondriac, it's all in their head, the doctors inevitably describe antidepressants, which can make you sicker quicker, make you feel terrible, and drive you crazy, make you feel like you're crazy or like you're a zombie, just flat affect. It's terrible, the adverse effects that these drugs, particularly the antidepressants and psychiatric psychotropic drugs, what they can do to women, and the sleep medications, all are addictive, and they can't be stopped. Don't stop them quickly. You have to wean off of them. So when we wean them off, before we wean them off, what do you normally do?
We get them balanced.
Their hormones balanced.
Exactly.
So as we get your hormones balanced, get you on a good eating program, and use vitamin and mineral supplementation. I forgot to mention that. These are very important to helping you maintain health and wellness naturally, so you enjoy a better quality of life. So if you're sick and tired of being sick and tired, and you want to get on a path of health and wellness naturally, Angelica right here can help you get on that path. She'll partner with you. We believe that everyone deserves to have providers who have the know-how, wherewithal, and expertise to coach you on a path of health and wellness naturally. So as you mature, you've got energy, you've got vitality, and you've got enthusiasm for life.
Yay.
Wouldn't you like to have that back again? Well, give us a call here at the Hotze Health and Wellness Center, and we'll be glad to partner with you and coach you on that path. God bless you, and thank you for joining us today. And thank you, Angelica, for joining us.
My
we
pleasure.
Appreciate it.
Thank
God
you.
bless you.
Thank you.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.